So, the topic we're going to discuss today is about the bile duct tumors. We'll be talking about malignant and non-malignant tumors, and obviously we'll be talking about their classification and their most common sites and their categorical distribution as well. So before going into the details of the tumors and their classification, we should have the idea about the biliary anatomy and the connection of different channels within the liver, and which are the extrahepatic. So actually this biliary channel is divided into intrahepatic portion and the extrahepatic portion. So we know that actually the formation of the bile, that's a part in physiological function which is accomplished by the liver. So actually there are some kind of the bile canaliculi, and these canaliculi actually they combine together and they form different types of the duct, which are interlobular ducts, which are intralobular and interlobular duct. So basically what happens is like these bile canaliculi, they combine together, they coalesce, and they join together to form the ducts. So these actually, the segmental division of the liver is very much important. We know that whole of the liver parenchyma is actually divided into 8 different segments, and the ductal distribution is according to the segments. So we are making the anterior and the posterior ductal system. So actually what happens is that bile canaliculi, which are involved in the segment 5, 6, 7, and 8. They combine together and they form the anterior and the posterior ducts, which are the intrahepatic and anterior posterior ducts. These anterior and the posterior ducts, they combine together and they form the right hepatic duct. In a similar manner, the bile canaliculi, which are involved in a segments 1, 2, 3, 4 of the liver, they actually combine together and they form the anterior posterior ductal system, which combine together and they form the left hepatic duct. So we know that these actually right and the left hepatic ducts, they combine and they form a common hepatic duct. So if we look at the part of the liver, so you can see that this is actually the liver, and we know that it's actually occupying the most right upper quadrant of the abdomen, and it's just present beneath 6 to 10 ribs. Okay, so if we talk about, we have different kinds of the canalicular system, which is actually involving the different segments of the liver. And these canaliculi combine together, they coalesce, they join, and they form a proper ductal system, which is the anterior and the posterior ductal system. And they combine together to form right and the left hepatic ducts, respectively. So you can see here, these are actually, you can see this is the right hepatic duct, and these are the different anterior posterior ductal systems which are combining together. They're forming the right hepatic duct, and this is the left hepatic duct. And it's actually the right hepatic duct is coming from the segments 5, 6, 7, 8, and 1, 2, 3, 4 segments. The ductal system and the canalicular system, they are actually combining it. They're forming the left hepatic duct. So these right hepatic duct and the left hepatic duct, they combine together and they form the common hepatic duct. So you can see this is actually the confluence. Okay, so these right and the left hepatic duct, they actually combine and they join at the hilum of the liver. Okay, and they are forming actually the common part of the hepatic duct, and this is the extrahepatic biliary channel. So we talk about the intrahepatic biliary channels, which were the right hepatic and the left hepatic ducts, and these right and left, they're intrahepatic, and the common hepatic and the cystic, their combination and the formation of the common bile duct. This is actually the extrahepatic part of the biliary channel. So we know that this is the most intrahepatic, this is the hilar, you can say the proximal part, and this is the supraduodenal, or you can say the distal part, which is just present behind the head of the pancreas, and it's retroduodenal and retroperitoneal, and it then enter into the second part of the duodenum. So you can see this is a C-shaped curve of the duodenum, and it's entering into the It's actually forming an ampulla of the bladder, combining with the main pancreatic duct, and it's opening into the medial part of the duodenum, which is called as a major duodenal papilla. So this is actually the distribution and the formation of the biliary channel. So what happens is, like, this is the liver, and it's synthesizing the bile. So by the help of the bile canaliculi and the ductal system, the secretions, or you can say the biliary secretions, they come all the way to the hepatic ducts, and then they drain into the second part of the duodenum. So any pathology in the form of the tumor, in the form of the cholelithiasis, in the form of the choledocholithiasis, which leads to the obstruction to the drainage of the bile, that will lead to the development of the jaundice. And similarly, you can see this diagram as well. We have actually these are again the right hepatic and the left hepatic, and this is the confluence, and they're combining together, and they're forming the common hepatic. So common hepatic is actually the extrahepatic part of the biliary channel, and it's combining with a cystic, which is coming from the gallbladder, and it's forming the common bile duct. And this is actually the main pancreatic duct. This main pancreatic duct combines with a common bile duct, and together they drain into the second part of the duodenum, which is major duodenal papilla. So you can see the cystic duct, and you can see the right hepatic, and you can see the left hepatic duct as well, and obviously the common hepatic, and then the common bile duct formation. So we talked about a phenomena which was called as a choledocholithiasis, but the bile duct tumors, which are also called as the cholangiocarcinomas, they are rare and they're not very common. And if we talk about their origin, so they can be epithelial tumors and there can be non-epithelial tumors. So if we talk about the epithelial tumors, there can be adenomas, there can be cystadenomas, there can be papillomas. These are actually the benign categories. But if we talk about the malignant categories, then there can be adenocarcinomas and there can be squamous cell carcinoma. But most commonly, adenocarcinoma, they make up about 90% of the whole of the tumoral bulk. And there's some non-epithelial tumors like neurofibromas and neuromas and lymphangiomas and hemangiomas, and these are actually the non-epithelial tumors in origin. This is actually depending upon their origin. This classification, which is we talk about the epithelial and the non-epithelial tumors, so this is based upon their origin, if they're coming from the epithelial cells or they're coming from non-epithelial origin. Now, there's another classification of the tumors that is based upon the division, or that is based upon the location, okay? So if we talk about the location, the part of the carcinoma which is involving the intrahepatic ductal portion, that is called as intrahepatic cholangiocarcinoma. And all those tumors which are outside of the liver or extrahepatic, they're called as the extrahepatic cholangiocarcinomas. But there is another division which is categorizing into three categories. One was the intrahepatic, which was involving the intrahepatic ductal portion, and then we have the hilar, or you can say the perihilar cholangiocarcinomas. So this is actually the perihilar part, which is actually involving the confluence of the right and the left hepatic and some part of the common hepatic. And then the distal cholangiocarcinomas, which are involving the common bile duct. So this classification is based upon their location. And let me tell you that hilar or the perihilar cholangiocarcinomas, they make up the most of the proportion. Almost 50% of the tumors which are coming from the bile ducts, they are actually the hilar, or you can say the perihilar cholangiocarcinoma. So the remaining 30%, and they are the intrahepatic, and 20% of the proportion is made up by the distal cholangiocarcinomas. Okay, so this was actually the classification depending upon the origin and the classification depending upon their location. Now, we already talked about the distal bile duct tumors, which are involving the most of the part of the distal common bile duct, or you can say the whole of the bile duct, just beyond, or you can say just below the cystic duct. And then we have the proximal bile duct tumors. We talk about the proximal bile duct tumors, which are usually the hilar or the perihilar. And then we also talk about the periampullary cancers. They are actually the periampullary cancers. They are most commonly along the ampulla of the bladder, where both of the ducts, they are combining together, and they're merging and they're entering into the major duodenal papilla. But if you talk about, just if you want to be limited to the cholangiocarcinomas, remember that they can be proximal, or you can say they can be intrahepatic, they can be hilar, and they can be distal cholangiocarcinomas. And among that, perihilar or hilar cholangiocarcinomas are the most common one, although this entity is very rare.